All right, so the hardest thing to get people to sit up into a posture that's adequate is try to convince them that it's necessary. He's probably convinced already because he's probably already getting some headaches. All right, but you will get a lot of people who sit there and think, why do I have to get into decent posture? And there's lots of different reasons. You can shove that last slide in front of their face and say, these are all the things that make you become vulnerable when you're in this posture. All right? You can hold them down into this position and say, take it. Well, we'll do it. Everyone sink down into this lovely posture. Don't come out of this posture. Take a big, deep breath. Don't move out of it. All right? Come up nice and tall. Up here. Now take a deep breath. Wow, it's magic. All right, a lot more air into the lungs because your diaphragm can actually move in freely because it doesn't have to push your liver and your stomach out your bum to do so. All right, you've got some space there. You don't have to use your upper respiratory muscles. When you do have to use your upper respiratory muscles, drags that first rib up, hits the brachial plexus, nerve conditions you remember from yesterday. So that posture has lots and lots and lots of deficits to it. Convince them. The other thing we can do is, and I know Dan did this a little bit this morning, is you can sink down onto the person's shoulders with your body weight. Poor posture, mate. Poor posture, sink, and that will often reproduce someone's pain. Oh, that's got my pain. Or they'll sink and curve into a particular position, winding up some joints. Right? That's often enough to convince someone. The next thing is, how do we get them out of this posture? What's a simple, quick way to get them out? Do we go, right, I want your AIS to be 2.1 centimetres in front? Not going to work, right? Not enough time. Simple way to do it, put your finger on the top of their head and push my finger to the ceiling, please, sir. Nice and tall, nice and tall. If you've got some hair left, grab hold of it, give it a bit of a yank. All right, yank them up so you're trying to pull them to the ceiling like they've got a fish hook through the head, drag them up, and that's going to get the spine into its most lengthened position. All right, so nice and tall, nice and tall, nice and tall. The only other thing you might have to do, have a look at their pelvis. Some people have the amazing ability to go and stay in a posterior tilt, Ferrari, like so. Okay. So, how do we functionally get someone's pelvis into a neutral position? All right. Again, rather than worrying about where the ASIS, PSIS is relative to each other, I'd prefer to go functional. Where is functional? You put everyone stand up for me, please. If you put a finger either side on your multifidus, when you posteriorly tilt, all right, posteriorly tilt your pelvis, you should feel your multifidus turn off, yeah? When you anteriorly tilt, you'll feel them turn on, all right? Posteriorly tilt off, anteriorly tilt on. Where do we go? Go into a posterior tilt and they're off. Start winding forward until you feel that first little contraction. That first little contraction, you can go backwards and forwards a few times to get it right. That first little contraction means your multifidus are now activating and they're now supporting or stabilising your lumbosacral spine. That is a good functional position to be in. Park your bums. So, up nice and tall, sir. Thank you very much. Anteriorly tilt, which they won't understand, but you can teach them that. Your pelvis forward for me. Backward, yeah, up, forward, forward. Oh, right there. Beautiful. Nice and tall. Now in this position, stay there, we can put our entire body weight onto, they can see I'm jumping up and down, and you won't be able to buckle that person at all, and they'll go, oh, it's a miracle, my pain has gone away. What have you done? You've put the body's segments, the vertebral segments, into a position where they've got good form closure. Now, instead of one of the segments or two of the segments bearing all the load, you've got all the segments bearing load. So 9.8 metres of acceleration on your head all day long with gravity, okay? Not going to notice it any 1 second, but cumulative over a day, then we start getting joint degeneration and so on. So this is a position we want people in. Now, how do we make it into an exercise? Can I get your feet a little bit underneath you, please, sir? So, you'll be amazed at how many people are absolute motor morons, and that might take about 3 sessions in itself. Now, and you go to sit to stand, you think, well, this should be pretty easy, right? Whew. Keep your patience. So from this position, we want to keep them in this postural setup and get them into a standing position. So we need them to break from their hips and their hips only. All right, so to do that, we want your chest to come forward and down. While you're breaking your hips, keep your chin up. And we want to get the weight over your heels. As soon as we've got weight over your heels, we want you to push through your heels, which will help engage your glutes and your hamstrings, rather than your adductors. Through your heels and then press up. Now, he did that magnificently. And then the way we sit down is exactly the same. Point your bum backwards. Whoop. Oh, see what he did wrong straight there. He went into the flex position. Point your bum down. Keep your head right up. And down, down, down. Weight on your heels. And you'll get better at it. What some people will really struggle with, thanks mate, is initially people will, through habit, collapse and push up through their adductors, right? So this position, this rocking motion in itself might take some time for people's proprioceptivity to figure out and to accept as a way I'm now going to sit to stand. Some people will get to this position, push through the heels and go, there ain't nothing happening, mate. There is absolutely nothing going on. No, I'm not going anywhere. With those people, what you can do is just get them into a rocking motion, and you'll find that each time they get a little bit further up until eventually they can propel through their heels and stand in that position where their spine remains in that neutral posi. Okay? So again, from this position, just rocking backwards and forwards a few times. Almost there, and up we go. And we sit down the exact same way. If you watch, for those people that can see, my shank does not come forward. My shank tries to remain that 90-degree angle as much as possible. Okay, so it's like I'm squatting. Don't laugh at my squatting technique. All right, but if you watch someone in the gym who's trying to squat, that's how they will squat. Especially you, John. Don't laugh. All right, that's how they will squat, because that's a position which they're going to get the maximum performance out of their musculature and also be the least possible chance of injury. All right, so that's how we try to propel people. Sit to stand. Okay, so 1, multifidus, break from the hips, push through your heels, same thing back down. You can create what I'd say is 3 to fatigue for an exercise a couple of times a day. Fatigue is when I can't do anymore because I'm starting to shake and shiver, or I've lost all perception of what I'm doing with this exercise, so their brain needs a break. Cool? Sit to stand.